It's probably a function of behavior. It's probably not something that's innate to the virus itself. The virus hasn't changed in any form. Probably older people are doing a better job of protecting themselves right now, and younger people are being a little less cautious, and they're more likely to get infected. And also the congregate settings that were reopened are probably places, venues where young people are more likely to congregate, like the bars, which were closed today in 2 states. And so it's probably just a function of behavior right now. The concern is, though, that you have so much infection at a community level in these states now that it's going to eventually seep back into older populations that are more susceptible to the virus, and you're going to see death rates go back up. And we probably will see the death rates go back up, or the total number of deaths go back up over the next 2 to 3 weeks.
So what exactly happened here? I mean, everyone's saying that some of these states opened back up too early, opened too aggressively. I mean, could it be that they shut down too early before they actually saw rising cases?
Yeah, it's a fair point. I think that we did a national synchronized shutdown at a point in time when not every state was equally affected. And so the states that had shut down against the backdrop of what they felt wasn't a lot of infection were a little bit more anxious about opening up. And they opened up against the backdrop of a fair degree of infection. You look at Georgia, Florida, Texas, even California, South Carolina, Alabama, states that are having very large outbreaks and epidemics right now, reopened against the backdrop of a good amount of infection, as opposed to states like New York, New Jersey, and Connecticut, which really crushed their infection and reopened against the backdrop of very little relative infection. Massachusetts is in that bucket as well. Same with Maryland. I put in that bucket. Michigan. Those are states that had very big epidemics, but really drove it down to very low levels before they reopened. And so there was some inevitability that there was going to be an upswing in infection because you had people now interacting more socially against the backdrop of an already high level of persistent infection. I think the velocity of the spread and the level of infection right now surprised many of us, but it is what it is right now, and it's going to be hard to extinguish. These trends that are in motion right now are going to continue in motion for a couple of weeks. Anything we do right now from a policy standpoint really isn't going to have its intended effect for 2 or 3 weeks. And so there's trends underway in terms of spread that are going to continue into next week, certainly, and probably the week after. And then you have to ask yourself whether or not the policy steps that have been taken this week are robust enough really to reverse those trends. They might not be. We might have to end up doing more. One last point I'd make is that New York City announced the effective lockdown, the stay-at-home order, on March 20th. They didn't peak in terms of the number of infections until April 7th about, so 3 weeks later. And so it takes a while for the policy action to have its intended effect at reversing an epidemic spread.
Should there be a nationwide rule requiring masks to be worn in public?
We need more synchronized action nationally. We can't deal with this on a state-by-state basis if we really want to drive the infection rates down, because we're just going to continue to reinfect ourselves across the country. That said, it's going to be very hard to implement a nationwide rule around public health measures like that. There's reasons why a lot of these decisions are delegated to states. There's good reasons why they've historically been delegated to states. States have different customs, different laws, different public health infrastructure. But the federal government has tenuous authority about implementing uniform kinds of public health measures like a national quarantine. Certainly they can lead by example, and they can jawbone, and they can encourage governors to try to take more uniform action. And that could work. But the authority, the federal authority in this regard, is actually limited.